Is it audible, madam? Hello. Okay. Om Shri Dhanvantaraye Namaha. Good afternoon, everybody. I, Dr. Swagath.N, Associate Professor, Department of Roganidana. It gives me immense pleasure to introduce and welcome today's guest speaker, Dr. Swagath sir. Sir was born on 20th May 1978 at Hassan. Sir has completed his BMS in SDM College of Ayurveda, Hassan in the year 2000. Sir completed his MD in the subject Kaya Chikitsa from SDM College of Ayurveda, Udupi in the year April 2006. Sir has clinical experience of 16 years. Sir achieved best paper for essay on nutrition deficiency in Ayurveda conducted by Ayurveda Academy during Swasthya Masa celebration in the year 2000 on eve of Dhanvantari Jayanti. And Sir was awarded twice as best physician, one among the top 10 physicians of SDM College of Ayurveda and Hospital Hassan on the World Doctors Day in the year 2008 and one more Best Physician Award in the year 2009. Sir has presented paper on the topic Oncology and Ayurvedic Perspective in National Seminar named Medical Oncology in Ayurveda in the year April 2005 held at Kannur. Sir has also presented paper on topic Effect of Dhumapana in Tamaka Shwasa in the International Seminar on Research Methodology and Statistics held at Trivandrum in the year February 2004. Sir has participated in various scientific meetings and symposia, also in workshops. Sir also worked as medical officer in various medical camps. Sir has given a talk in All India Radio on topics like Hridroga in Ayurveda, hypertension and Ayurveda management, Sandhivata and its management. Sir was member of editorial board of book LS during the CME on Sandhigata Vata at SDM College of Ayurveda, Hassan. He was also member of scientific committee of terminology conference held at SDM College of Ayurveda, Hassan on Panchakarma in the year with this brief introduction.
Hello. Hello. Hello.
Hello, sir.
Shall I start?
Yes, sir.
Good morning to you all. I think I shall close my video so that it will be clearly audible. No issues?
Okay, sir. Okay.
Right. So, today the topic of presentation is Avarana. So we all know that when we were students, I especially, we were running behind what is this Avarana. Avarana is a big concept. We have to understand this. Clinically identifying this Avarana is very, very difficult, And it is just like how when final year students run behind to learn ECG, the same way Ayurvedic physicians or Ayurvedic students run behind this Avarana, which is a unique concept in Ayurveda. So this is how it looks. If you see that who is on top, we don't understand this. This is how it looks when we see Avarana. This is the phenomena. This is the stage what we stand. Uh, so if we look at this woman, we can see. If you see at one angle, we see that there is a young lady. If you see at the another angle, we see an old-aged woman. So which is it? So it should be either one. It cannot be both. So this is how Avarana looks for us. And once if you go and think the otherwise, it may be like this. We get uh, very embraced if we don't make a proper diagnosis. Hasty decisions make you confused. So before that, understanding the Avarana concept, what I feel is we have to understand the basic concept before going to the practicality of the Avarana. We have to see what exactly is Avarana, the basic theoretical structure of the Avarana given in our classics. So by definition, what exactly is Vayu? The Vayu Guna is explained initially while explaining the Vatavedi. And why this Avarana was explained in Vatavedi is because the Vayu among the three doshas is supreme. It is supreme, it has got the Rajoguna Bahulya, and as it is supreme, it can manifest n number of diseases. Especially if you see Nanatmaja Vatavikaras, or the Nanatmaja Vyadi, they are 80 among the Pitta and Kapha. You compare, it is more in number. And it is the only for the just for their understanding, and it can be n number we have got. So what exactly is Vayu stage or Vayu's function? We know in Vatakala Kaladya it has been explained a lot about the Vayu and Vayu Rentrustan Tatraha. And but here in Charaka Chikitsastana he says Vayu Ayur Balam. It gives life span. Balam, Vayur Data Shariranam. It gives you the life to your body. Vayur Vishwam Vidam Sarva Prabhur Vayu Vayushcha Kirtita. It is the Sarva Prabhu. It is the Pravartaka of all. So by definition, let's straight away jump to the what exactly is Avarana. Avarana. To understand this Avarana, we need to have some of the definitions and some terminology, basic terminology. This is just theoretical part what we are saying. So what exactly it is? It says this Vega Pratibandham. What is Vega Pratibandham? Vega is Vayu has got Vega. It moves from one place to another. That Vega or the movement is Vega here, not the speed. It is the movement. The movement of Vayu Pratibandha is stopped or obstructed. That is what we have to understand. Avritya Avaranjati Ityarthaha. Avaraka Achadake. Avaranam Achadanam. Avarana refers to Achadana also. Avarana means encapsulation. Avarana Achadana, it is obstruction. These are the different words what we can see in the classics. Now the Paryayas also has been told Veshtitam, Valitam, Samvitam, Ruddham, Samanvita, Anvita. These are some of the different Paryayas which has been told in classics. Now, by definition, what is Avarana or Margavarana? Margavaranena Vega Pratibandhateva Kupito Bhavanti. Because of this obstruction of this Vega of the Vayu, let me go to Vega of the Vayu, this Vayu which is obstructed becomes aggravated. So what happens is it becomes aggression. It has been stopped or somewhere else and it gets piled up and it is aggravated because it cannot go further. We all know that Ekadesha Vriddhi Anidesha Kshaya. This is what happens once it is obstructed, it is Vriddhi happens. So next we see Shrotebhyo Anya Dosha Purnebhya Avaranam Prapya Vali Vayureva Vakupyati. This is a very wonderful definition by Avarana term. What it says is the Anya Doshas, the other doshas which other than the Vayu, that is Pitta and the Kapha, get accumulated in the Shrotas and produces Avarana for the Vayu Marga. That is called Avarana. That is by the here doshas refers to dosha and dhatus also. Next is Vatadi dosha kramashaho dhatu sarvangam evacha avritya kurute yasmat tasmat avarana. The occlusion or obstruction produced by the Vatadi doshas is called as avarana by Vaidyasara Sangara. Now, some of the terms what we have to understand is Avarana Vata. Avarana Vata means Avarana is obstruction or encapsulation of Vayu by Pitta and Kapha, that is doshas, or the Saptadhatus, Malas, or Upadhatu, and also Anna, Ama, or the other things due to which it is obstructing the Vayu is called Avarana. So, other term what we will get in this Samanya Avarana. Samanya Avarana refers to the obstruction by dosha, dhatu, and mala. Next is Anyonya Avarana. Anyonya Avarana is Vayu. We have got subtypes of Vayu. We all know that the Vayu has got 5 subtypes based on its karma. So, based on this karma, when Anyonya Avarana means the one subtype of Vayu obstructing the pathway of the other subtype of Vayu, that will cause the Anyonya Avarana. The next term what we get is Avaraka. What is Avaraka? The one which obstructs, that is Avaraka, or the factor which obstructs the Vayu is known as Avaraka. Example, if Kapha is causing Avarana of Vata, then Kapha is called Avaraka in this context. Next, what we get the word is, the fourth shloka, it says, Avyahata gadir yasya sthanastha prakrutostitaha. If the Vayu is in the sthana, or it is sthana means swasthana, it is moving its own channel. We have got in Sushruta, it says, dosha siras, then it is moving its own channel, or the swasthana, without hindrance. Avyahata gati means without hindrance. Gati of the Vayu should be avyahata. There should not be any obstruction in the gati. Then Vayu will do the Vayu shats, so adhikam jivit vita rogaha, means the person will live for 100 years without any disease if the Vayu is not obstructed anyway. Next, in case of Anyonya Avarana, is also there is some word what has been said is Gati Nirodha. In other words, it is said Gati Hanana. What is Gati Nirodha means? Obstruction of the Gati of the Vayu. Pranavata or Udanavata having the upward movement and the Apanavayu having the lower movement, if they are obstructed, then that Gati Nirodha is called Avaraka. The one which produces the Gati Nirodha is Avaraka. Next, in case of Samanya Avarana also, the Gati Nirodha is produced by Pitta, Kapha, and Mala Mutra. And Sweda is not there because Sweda, once it comes out, it cannot do the Avarana. Then only we call it Sweda when it doesn't come out, it is not called Sweda, and that is the reason Sweda is not given here. Next is the Avrita, word Avrita. What is Avrita? The one which is encapsulated, it is Avrita. So at all the time, Vayu is the Avrita. Krita Avaranaha Avritaha. That which is covered is called as Avrita. In Samanya Avarana, Vata and its Beda is called as Avrita, and Anyonya Avarana, Vayu and its subtypes is also called as Beda. Okay. Next is the Lanai says, Doyor Marutayor Abhimukha Abhisarpata Balavata Durpalo Abhibhuta Pratyavrita San Avrita Itrichite. So here what it says is the one which is weaker, two types of Vata moves towards each other, and one which is weaker will be overcome by the stronger one. That is obvious everywhere. So wherever this Avarana has been explained, some of the diseases where Avarana is explained is Vatavadi, Grahani, Staulya, Prameha, Urustamba, Ruchula, Vataraka. Let us see. Now, here we will see only Vatavyadi Avarana. What is Vatavyadi Avarana? Yochapi Chatra Kapha Pitta Vata Vata Vikara Vata Vyaditvena Vaktavyaha Te api Pradhanam Vatam Vinana Bhavanti Kritva Vatavyadi Rupa. The element arising out of the occlusion of Vayu by Pitta and Kapha, also designated as Vatavadi. Even they are Vatavadi. Make it very clear. These Avaranas which has been explained, they are one among the Vatavyadi, because such disease never manifests without the predominance of the involvement of Vayu. This is very important thing. When we are seeing the practicality, you will understand this also. So Charaka says, Vata Pitta Kapha De Sarvasvata Nicharana Vayu Reva Sukshmatvat Vayu Tatra Api Udiranaha कुपितस्थो समुद्यो तत्र तत्र क्षिपन् गदन् karoti avrata margatvat prasadincha upashoche. So what happens when this vayu, it gets association with the pitta and the kapha and they move in the slotas. Because of the sukshmata, the vayu it is responsible for the udirana. It does the vriddhi of the pitta and kapha, and with the vriddhi of the pitta and kapha, it goes and dislodges at some places and does the margavarana, and after the margavarana, it does the prasadimsha upashochet. Upashochet refers to here the shoshana of the sara of the dhatu. So we know that there are two types of generally avarana, that is murtavarana and amurtavarana. What is murtavarana? The vayu does not have a physical entity. It is an karma based entity. It is not a physical entity. We cannot see it, we cannot feel it, we cannot touch it, but we can feel it. So it is the murtavarana, and it is, other is the amurtavarana. So what is murtavarana? Murtavarana is the avarana of the vayu caused by the murta. That is murta, kapha, pitta, dhatu, mala. All these are physical entities which have physical body. So they does the avarana of the vayu gati or the vayu pata. Then that is called as murtavarana. Then what is amurtavarana? Amurtavarana refers to when the subtypes of vayu, they does the encapsulation or the obstruction of this gati of vayu, then that is called as avarana or the amurtavarana. Now let us see what is the general principle of symptomatology, how the symptoms gets produced. The symptoms is very clear that one which is stronger produces the symptoms. Best word I can say. But generally, always why the avarana takes place is in among them one which is stronger. The stronger one is always the avaraka. Always when the avaraka is stronger, then only it can encapsulate or obstruct the other one. Otherwise, it cannot obstruct it. The stronger always obstruct it. So when the avaraka obstructs the avarya, or when the vayu is obstructed by other element, which becomes avaraka, then that element produces its own symptoms. It shows its own symptoms because it is being in the stronger pathway. So it is in the upper hand, it shows its symptoms. If at all to a very worst condition, anyetu avaraniyasya swakarmahani avarakasya tu utsarga vruddhir bhavati iti vyavastam aho. So here only in the last phase, there avaraka loses its functions or normal functions. Swakarmahani, avrita is swakarma, vruddhi happens. In Mishra Avarana, what happens? Lakshanam tu vimishritvam pittasya cha kafasya cha upalaksha bishak vidwan Mishra Avaranam vadet. When there are two doshic factors involved, then that particular condition is called Mishra Avarana. That is, when pitta and kapha both are involved, then that is called as Mishra Avarana. Then the prognosis of this Avarana, how it happens, what exactly would be the prognosis? The general prognosis is in dosha avarana. We have seen dosha avarana, dhatu avarana, all this. In dosha avarana, when this avarana is occurring on subtype of vayu, that is prana and udana. Subtype of vayu, among them is prana and udana, is obstructed by pitta and kapha, then these are more severe and they are difficult. It is also called by Dalana as Gurutaram Bhavati. That is Gurutaram Bhavati means they are very much difficult to treat because Pranavayu and Udanavayu has got vital functions of the body in the physiology, Sharira Kriya. So when that leads to obstruction, then they does the Pidana, and as we saw that Vayu is giving the Bala and the Ayush, and that Bala and Ayush is lost here, and that leads to Nirayusha and Valahani. The person may lose his life. Next is Dhatvarana. In Dhatvarana issue, the most difficult one is Medobhrata Vata. that is Medhasavruta Vata, is the most complicated version of the Avarana among the Dharma. In Anyonya Avarana, again, we've seen that Udana and Prana are most important. And here, again, when they obstruct each other, it is Udana Vrita Prana, then it is being difficult, set as difficult because there will be Ojo Hani and Balakshaya will be there. Once there is Ojo Hani, we have seen 3 stages of Ojo Kshaya, Vriddhi, Ojo Kshaya, Ojo Hani, Ojo Vishramsa. Then last is Ojo Kshaya, the person will die. This is what happens when there is Udana Vrita Prana. Now coming on to the Upadra, if it is not treated within 1 year, then also it becomes very difficult to treat. It is a general principle in Ayurveda. So Upadra, what happens if it is not treated properly? The person may get Rudroga, Vidradi, Pliha, Gulma, Atisara. All this can happen if Avritanam Upekshanat. If you are neglecting the Avrita, then this is what happens in the later phase and they manifest as Upadra. How to diagnose this case? Theoretically. Now, theoretically, how to diagnose is, it says there are certain principles to diagnose this case. Even if you cannot give the accurate treatment, then one has to go with the Tarka and Vitarka principle or the Uhuya. You have to assume Uhuya. And next is self-discussion. Swayamana Diyaha. You have to, with your knowledge or with your experience and with your textual knowledge, you have to understand the circumstance and you have to make the diagnosis. This is how you make the diagnosis. Next. According to Sushruta, what it says is Kevalo doshayukto va datubir va avato anilaha vigneyo lakshanabhyam chikitsitascha virodataha. That means how we are to diagnose this case is the diagnosis is done between the Kevalavata, Samsargavata and Avritavata is done on the basis of the presenting symptoms and Uhya. That is by applying reasons with your experience. You have to do that. Diagnosis is Avarana by exclusion or trial and error method. What happens is Shanai upashayat gudam api murmu. What happens is you have to do the upasha and upashaya chikitsa, that is trial and error method by the therapeutics. You should give them some medicines which you feel. For example, if it is you feel that it is Kevalavata, you give the Snehana. Then if it doesn't come down or if it comes down very short period and it reoccurs again, then it is not Kevalavata. You have to analyze that as Avaranavata. And you need to do the Avaranavata Chikitsa, then it responds. Or else you can straight away go with the Avaranavata Chikitsa and then treat it. And if you get response, then it is clearly Avaranavata. If it doesn't respond, then you have to think that it is not Avaranavata, it was Kevalavata or Samsargavata, which you need to treat. Not exclusion by Nidana. So when you see the Nidana, in case of Vata Vyadhi, what we say, we have got 2 Nidanas. One is Dhatukshaya and other is the Margavarana. So when you see the Dhatukshaya doesn't take place at one shot or for 1 day or 2 days. Suddenly it does not happen unless there is an external injury or there is Ati Chardi or Ati Sara. These are happening or severe blood loss is there, then sudden cut injury or there is severe blood loss, then they may have a sudden Dhatukshaya or else this Dhatukshaya doesn't happen on 1 day. When we have this Dhatukshaya during the course of long duration, then you will have a clear history of Dhatukshaya or weight loss day by day or any chronic illness you have, and then the person will have a Dhatukshaya. This Dhatukshaya or the Dhatukshaya Nidanas, which has been explained in classics, when that Dhatukshaya is there and then the person gets the Vata Vyadhi, then it is clear indication as Dhatukshaya Janya Vata Vyadhi. If at all not, then it is Avarana Janya. On the contrary, history of indigenous in Avaraka is available, then you have to think that it is because of the Avarana. When another example, another disease example, what we can take is the Madhumeha, where in Nidana he says that due to Dhatukshaya and Margavarana, they can be 2 sets of different entities. So here you can see the Madhumeha, the Nidana Datukshayajanya Madhumeha and Nidana Avarana Madhumeha. You can see wherein Avarana Madhumeha, the person will indulge in Guru Snigdha Amla Lavana Nicha, wherein there is Kafa Vriddhi, Atimatram Samasadam, Navamannam Chapanam, and Nidanam Asya Sukani. Whereas in case of Datukshaya, if you see Kashaya, Katutikta Rasa, is it consumed, and Ruksha Lagushita if it consumes, and Vyavaya, Vyayama, Vamana, Virechana, Astapana, Shiroviri, that is all the Panchakarmas, Sandana, Anashana, Abhigata, Atapasevana, Udveka, Shoka, Shonita Disheka, Jagarana, Visham, Shariran, Anupasevana Manasya, Tata, Vida, Sharira Seva, Kshipram Vata Prakopam Aha. All these causes the Vata Prakopa instantly, which leads to Datukshayajanya Madhumeha. Next is Samprapti, explanation of Samprapti, exclusion by Samprapti. Once you see that the Samprapti is there, I will not test the Samprapti of the Datukshayajanya, I will straight away talk the Samprapti of the Madhumeha. What happens when, because of these Nidanas, the Dosha Prakopa is there in the Avaranajanya Madhumeha, Satra Prakupitasta Tatavide, Sharire Visarpan, Ojaha Punar Madhura Subhavan, Tat Yad Raukshat Vayu, Kashayatvena Abhisamsrutya, Mutrashayo Abhivati Tada Madhumeham Karoti. These Rukshat guna, which has been aggravated, they converts this natural Madhurasa and they carry it to the Mutrashaya and they result in Madhumeha. How to find out is this Datukshayajanya or Margavanajanya? Very clearly it says the one beautiful word by Lakshana, how you can find out. Lakshana, you can see this, the second sloka. Samartasya pittasya kafasya cha muhur muhur darshayati. Muhur muhur darshayati karoti gatva kshayam apyate punaha. Means that muhur muhur dasyati, that means it is waxing and waning in phenomena of the initial phase. In the initial phase of the Avarana, Avarana Janya Madhumeha, the symptom of the Madhumeha will be initially waxing and waning. Likewise, how you can see in the clinics is, you see a patient who is hyperglycemic status, and you should consider, is it to consider with the diabetic mellitus or not, then you have a question mark. Then when the person has got hyperglycemic status, and after 3 days, without any medication or with just simple diet, he becomes normal, or without any simple diet, he becomes normal. The patient will tell, even I am eating sweets, I don't have any hyperglycemic status. Nowadays, the patients will have glucometer at their home. They will only tell you, this was my reading. And when they say that it is normal for 3 days or 4 days duration, and again it was increased, or the waxing and waning phenomena, if they explain you that they have checked it at home and this was the phenomena, then that phenomena is considered as the Avaranajanya Madhumeha. And later phase, after some duration, the Avarana phenomena will not be there as more Darshayati. Then it becomes, and the phenomena of presentation is again Akasmat Darshayati. In the context of Ashtanga Hridaya, he says Aniyataha. Aniyata word refers to Akasmat Darshayati. In Margavana, he says Aniyataha. The presentation is Aniyata. Aniyata means Akasmat Darshayati. There is sudden presentation. The other phenomena of the Avarana is the sudden presentation is also the phenomena of the Avaranajanya Vyadis. Next is exclusion by Upashaya. Here Upashaya of Avrata Vata will not be there. On the contrary, Upashaya of the Avaraka will be available. So for example, in Pitta Avrata Vata, the patient is getting the Vidaha Vata Upashamana by Vata Upashamana and shows Shita Kamitva, which is the Upashaya of the Pitta. It clearly indicates that it is the phenomena is the Avaranajanya phenomena, not the Samsargajanya. Exclusion by Chikitsa, you can see this Chikitsa also when you are treating the condition, when there is the, in Pitta Vrata Vata only we have taken Shula, Daha, Trishna, Brahmatama, Lakshanas are there, and being Shula, if one Vatara treatment is given, Ushna, Amla, Lavana is given, it will worsen the condition of the Pitta. So, to relieve the dominant Lakshana of the Vata, Pittahara Chikitsa should be taken as the basic pathology is due to the increased Pitta. Next, to understand this in a better way, we have got two basic pathologies, that is in the Vayo, Dhatukshaya, Kopo, Marga. Here, this Dhatukshaya, Avarana, what happens is there are two distinct entities. This Margavana is an process, disease process, which occurs at two distinct entities. What is the two distinct entities? One is at the Nidana level. The Margavana occurs at a Nidana level, which means the Margavana will be a Nidana, a causative factor. The process, Margavana process happens, and after the process is done, there is Vata Prakopa, and that is Nidana Janya Margavana. Other process is again, it is Samprapti Navyadi, and that is again one of the Margavana, and that Margavana leads to Lakshanas. So there are two different stages of this Vatavedi, and that is one is Margavana at the level of the Nidana, Margavana at the level of the Samprapti. So let us see certain disease process where we will have the Avarana word. Morbid Vata and Kapha afflicting the Rakta Dhatu generates a swelling at the mouth of the bladder and then obstruct the evacuation of the urine, and the person suffers from the pain as if there is Ashmari or the kidney stones or renal calculi. The pain is similar to the renal calculi. The patient who is not unable to pass the urine, it's a clear condition is urethral stricture. Urethral stricture, what we can say, and Mutra is not passed urine, urine is passed, not passed because of the Rattagarti. What happens here? It clearly said in Charakasithana that Granthir Kriya Chakrichrena Srijen Mutram Tadavrutam. Because of the Avarana, they pass the urine, but with Ashmari Samashulam. The Ashmari Samashulam is because of the Tam Rakta Granthim Pratakshate. And other word where we can see in Grahani Chikitsa, na Bojanena Kayagni Deepyate na Ati Bojanat Yata Nirindano Vanni Alpo va Ati Indanavrataha. Now here what is there is Agni is ignited, how the Agni gets ignited and Agni gets diminished. If you give excess fuel, for example, if you consume 5 liters of water within a span of 2 hours, then your Agni is subsided. Or if you consume 5 liters of water for about the whole day, then your Agni will not be subsided. This is how this becomes Avarana. The Agni is Avruta here, and that Avarana cannot cause the Agni to ignite. Now again, in case of Apasmara, what Charaka says is Vibranta Bodhoshana Aitashya Bhojana Rajastamognyam Bihate Satve Doshavrute Rudihi. The dosha does the avarana of the Hridaya, and the manas gets avarana. Chinta Kama Baya Krodha Shokodvega Vishtataha Manasya Bhirate Dhanam Apasmara Pravatre. That exaggerates the apasmara, and that exaggerated aversion causes the status epilepticus or the apasmara. And other case, one more condition where you can see when the basti is given and the basti dravyas are having alpavirya, and these causes the basti dosha because of the basti doshavrato ruddha margarandyat samirana. They cannot come out because of the dosha which is inside the body is strong enough to encapsulate or that does the avarana of the marga, and that avarana is also the doshavrata basti. Now here what I was saying is the different stages of the Avarana, that is one is the Nidana phase, other is the Samprapti phase. After the Nidana phase, what happens? Once there is the Margavana, the Vayu Prakopa takes place, and that Prakopita Vayu along with Pitta Kapha, Atha Prakopito Pitta Kapho Samudhyabhya Tabhyam Avrita Marge Api Tatra Tatra Pradeshe Gadan Karoti. Wherever it goes and gets dislodges, it gets encapsulated or obstructed by the Vayu, by the Pitta and Kapha, and it causes the disease, and it exhibits by the symptoms of Rasadimscha Tatra Tatra Samshoshet. It is the Shoshana or the Kshaya of the Rasadi Dhatus, which is more important. That means wherever there is the disease entity, Avarana disease entity, Distal to that, there will be Prasadincha Dhatu, Shaya Lakshana will be there. This is also another entity where you can identify that the disease is having Avarana. Other conditions where you can see Avrita Marga is Unmada. In Unmada, again you see Unmade Vataje Purvam Snehapanam Visheshavit. Kuryat Avrita Margantu Sasneha Mrudushodanam. Wherein it says very clearly that in case of Unmada, if it is Kevala Vata, then you can give Snehapanam. That is, Chakrapani says, Vatasya Niravarana Rupam Vishesham Janan Snehapanam Vataje Dadyadi. Darshayati. Next, if it is so because of Avarana, then Sa Avarane tu Tat Nishiddhaha. It is contraindicated if it is Avarana Janya Unmata. What you have to do? You have to do that. Meda Kafabhyama Anilo Niruddho Shula Anga Sukti Shavatu. You have to do Swasneha Mrudu Shodana with Mrudu, or you can go with the Sneha Yukta Virechana, then you will get the benefit. That is what Shodana should be done for the Avarana initially. You cannot straight away go for the Snehapana. That is, you clearly says how you can understand it by the Chikitsa. Next, another entity where you can find the Avarana is in case of Rutshula. Not in the Rudroga, it is the Shula Adhyaya, that is Gulma Adhyaya actually. Gulma Adhyaya, Shula Prakarana, wherein the Sushruta says, Kafapitta Avaruddhastu Marato Rasasammurchitaha Radishta Purute Shulam Uchvasam Arodakaha Sa Rutshulam Iti Khyato Rasamartha Sambhava. This is the clearly manifestation of the Marga Varna, wherein in Rudroga, or you can see present day ischemic heart disease or myocardial infarction conditions, the way there is an obstructive pathology or there is an what you can say, there is an no, it is not the obstructive. There is one more pathology. Not getting it. There is one more pathology. That also pathological. There are three pathological entities. Among them, two pathology. One is obstructive pathology because of the hypercholesteremia, and other obstructive. It is not obstructive. It is other pathology, and that pathology will also because does the avarana. And what they do is kapha and the pitta. They does the marga avarana, due to which the rasa sammurchana takes place. We all know that rasa and rakta, they circulate in the body simultaneously, and because of that, because the rasa sammurchana happens, then the radhista kurute at the hridaya, they does the shula. First is the shula, uchvasa, arodakha. That shula is because of the rasamaruta. That is how the shula, margavanajanya rutshula. Next is the Kaphameda Savarna, where you can see in Vatarakta. There is a beautiful concept which has been explained, wherein he says, Kupite Marga Samrodan Medaso, Va Kafasyava, Ativridyat Anile, Na Adoshastau. That means you cannot treat it with the Snehan and the Brahmana. Because even though there is Vata is there, Sushruta calls it Mahavatavadi, wherein there you, even though it is in Mahavatavadi, you cannot treat it with the Snehana and the Brahmana. Why? Because you have to treat it with the Vyayama, Shodhana, Aristapana, Mutrapana. Mutrapana refers to Gomutrapana and Virejana. Takra Vaya Prayojana, Shapayet Kafamedasi. That means here you can see all the treatment which has been explained is the reduction or the treatment for the Vriddhi of the Kapha and Medas, not for the Vata or the Rakta. So next, other things what you can give for the treatment is Puranayava, Goduma, Sidu, Arista, Surasavi, Shilajitu Prayogaihi cha, Gugulur Makshikasya. So you can find out here, when you are trying to do the trial and error method, you can just give it Shilajitu drug, or you can give it Gugulu Prayoga, or you can do Swarnamakshik Basma. The beautiful thing what you can say is here in Rutshula, the best drug or treatment which we told is Prabhakaravati, which contains Shilajitu, which contains Gugulu, which contains Swarnamakshik Basma. This is one such drug where you can give for the clearance of the Marga Avarana. Again, this Shilajitu contains is the Chandraprabhavati is one such drug where you can use this to do the trial and error method initially. Next, we have got one more word is called pratigata iti avarana in case of kasa. What is pratigata? Pratigata is the word which has been explained in kasa. If at all you think this is just word why I am taking this kasa, there are many places where this word avarana has been referred in the classics. So one such disease is kasa, wherein pratigata iti avarana is being said. So what is the avarana done by? The avarana is done by kafadi doshas. Kafadi doshas does the avarana of the vayu. So if we consider till now we have seen what exactly is the treatment protocol and how we are to do the treatment. If at all the vataja kasa is there, then the treatment doesn't substantiate that. You can see rukshasya anilajam kasam adau snehairupacharet सर्पिभिर बस्तिभिः पेययोजक्षिर रसादिभिः वातग्न सिद्धैः स्नेहाद्यैर धूमैश्च युक्तितः. You can only treat with the Vatahara line of treatment, but here the Margavana line of treatment is not been explained. Hence, this is not the Margavana which we see as a pathological entity. So this is a different entity other than the what we see in the Vatavadi. Next is what you see is in the case of Vatavadis, what happens is all these disease conditions in Vatavadi, especially explained Anyonya Varna, Mishra Varna, or Samanya Varna, there should be an Vatavyadi. And in Vatavyadi, this is a subpathological entity which happens in the body, and this subpathological entity which happens in the body, it has to be identified to treat that condition. Because once there is a Vayu Kopa, and that Vayu Kopa will take this Pitta, Kapha or any Dhatu, and it does the Dushana of that thing. And after doing the Dushana, what it does is it gets encapsulated by itself due to the vitiation of the other Dhatu or other element, or which is the Avaraka, and it gets hampered. And again, because of that, this Vayu becomes Prakopa and it does some disease with the Lakshanas of this, but the Lakshanas are more stronger in case of the Vatavadi. So because Vatavadi is one such disease wherein this Margavana usually occurs, and we have to identify it clinically. It's a very simple method to identify. One is the Rasadhyamsa Shoshet, where the thing happens or where the disease is happened. From there, the Rasadi Dhatus Kshaya will be there. You can see that. Other is Upashaya, by you can give the Prabhakaravati, you can give the Chandraprabhavati, or you can give Shilajitu, like these drugs, and you can do the trial and error method. Next method is you can see the Lakshanas which is pertaining to the disease. Next you can see by Chikitsa you can see the Sneha Pana you can do and you can check it out. And Nidana especially, Dhatukshe Nidana and Margavana Nidana. If at all it is a sudden onset, then it is Margavana. If it is the Dhatuksha, you can clearly see the Dhatuksha happening in the body until unless there is a special entity wherein like some blood loss or etc. These are the things where you can clearly identify this Margavana in the clinical entity and you can get given your practice. So with this, I acknowledge my guide and guru, who is a great Ayurvedic scholar, Dr. G. Srinivas Acharya, is principal of SDM Udupi. I bow my head, with whom I spent my lovely 3 years, and because of him, I am in this condition. So I thank him for all this knowledge he shared to me, and I conclude my this topic.